lecture. I will cheat a little bit, so I'm sorry for that. It's not my common practice that I have lectures in English language. Yes, I'm Metka Žitnik Šircelj, and if I may Google my name and Google Mr. Janko's name, we are Hans and Gretel. I don't know if you knew that. So yes, we are Hans and Gretel. You know the story about the Grimm brothers wrote it? So I'm Gretel and he could be Hans. I work in a community health care center of Ljubljana, more specifically the community health center of Rudnik, which is the smaller unit. And because it's a small center, not many people work there, and I often feel like going home not to work. And I work in a very pleasant and coordinated team, and I believe that working in a team is a necessity, and only if it is based on trust for one another. At the beginning of our work in this model practice, we didn't exactly know who's the patient was. And however, after we resolved our first initial problems, such as in which room the nurse practitioner is going to work, or do we have all the necessary appliances that we need, or even how or what should be working, we realized that in fact that this is our patient and that we all have a common goal, which is healthier, better treated, and happier patient. Because the title of this lecture is Patient's Attitude Towards Nurse Practitioner here in Slovenia, I suggest that we first take a look at what the evidence-based literature says. And the literature says that patients with several chronic diseases have a positive attitude towards a new work method. They get many useful pieces of information. The better communication is one of the advantages, because the nurses are using simpler and more understandable expressions about the disease, healthcare, etc., etc. This case was conducted on how the patients see us, and in this study they compared to the doctors, and they said that they usually don't understand the doctor because they're using too many medical expressions. And also patients get more instruction on how to live with the disease, especially on how to maintain a healthy lifestyle, which plays an important role in everyday life. We know that an unhealthy lifestyle can bring us to a new disease. So this is also important that they get knowledge. With the help of nurse practitioner, the quality of treatment increases significantly, and consequently the health and well-being of the patient improves. They receive, as has been already taken, a lot of useful advices, useful and practical. One of the advantages of our work is also knowledge, the better knowledge of patients' living conditions and lifestyle, and also of their social status. Because of the nature of our work, we can talk to them and take more time for them, so we can get to know them better, and this is, I think, the biggest plus of that kind of work. And nothing, and I really mean nothing, is more important than having somebody who listens to you. I don't know if you see the picture, yes, I see it. At the end of the day, when we run out of pills, only conversations are left in communication. These facts were obtained by research studies, which shows that patients are accepting as well and are in favor of our work. We all know that it's not always easy being a patient, especially when fear is present, especially fear for your own health. When I started working in this model practice, the patient didn't quite understand if I'm their doctor now and why they mustn't go to their old doctor, where's the catch? But this was just a transitional period, and after a while, and nowadays it goes like this. If the doctor asks the patient, can I measure your blood pressure, or how is it with your blood pressure, he goes like, you know, that's between me and my nurse, and I'm very happy for that. I would like to present you two case studies on which I was working this year. They were both qualitative case studies. In both research studies, the main question was how do patients see the work of nurse practitioner, and how did they benefit from seeing her. The survey was conducted with interviews to which every patient gave written consent. The first case study was conducted on newly diagnosed COPD patients who have taken a spirometry test based on risk factor, I don't know, smoking for 10 years or some symptoms of, I don't know, cough or something. And they were from age 32 to 75, and they were both men and women. The second study was a bit different. It was only on one female. She came to a routine checkup, and until that day she was healthy. And we dig down, and we find that she was simultaneously diagnosed with two diseases: diabetes type 2 and hypertension. And she was aged 58, yeah, okay. And I remember the day very well. She was crying when she saw her results, her blood test, when I measured her blood pressure, and it was not an easy day that day. But I will show you her results at the end. What did we do? In the first case study, I don't know why, I like to draw them lungs. I'm not a good drawer, but I like to do that. And they said that they liked it when I draw the lungs, that they can see what's happening in their lungs when they're smoking, because I don't have any model to show them. They also agree that the nurse has a big impact on their increasing their physical activities, and that also this conversation has a big impact on their thinking about quitting smoking. Only one had quit, but I think half of them has started to smoke less. In the second case study, that patient who has simultaneously been diagnosed with two diseases, she said that she at first didn't realize how serious the disease is. She thought that she's just going to eat less sweets and it's all going to go away, although her father had diabetes and she already knew something about it. I would like you to read the last line, which is my favorite, and she said, "You always listen to me. I like coming by to chat on how to proceed." And she said that that we gave her the most information and instructions on what to do. That we are easily reachable on the phone, and this is also a benefit because if she has a problem, maybe we can talk it out and find a solution. If the solution is too big, then we go to the doctor. So we are trying to keep the doctor safe just for a while if we can. And she also thinks that these practices are necessary, that they help you. And she said that it means a lot to her that she could come to see me that time, although she was crying for the first time. But these aren't just results of our good work, but of good teamwork. I would just like to quickly mention that if we want our patient to feel good, we must work as a team, and it all starts with good relations. I hope that you all agree with me. And this is what the literature says about that. That we, during our work, we establish a wide range of relationships, also with patients, our other colleagues, and that it has been proven that good collegial relations among nurse practitioners and doctors improve the outcomes of the treatment. I think this is very important. But sadly, these two working groups often function on the principle of hierarchy, which harms the patient. And please, if you want, with these sentences. An American study from 2010 revealed that a group of several women has a higher collective intelligence and makes better, more successful decisions regardless of how smart and experienced the individuals in it are. And ain't that a funny thing? My two kids, all women, no wonder. And I said, it's a teamwork. We have to be synchronized. And because of that, I said to myself, I have to ask my doctors, what do they think about it? These are the questions that I send them. How did you imagine the work in family practice before starting it? Has working there met your expectations? In your opinion, which are the biggest problems and advantages of such work? And how do you view the work of nurse practitioner, the important one for me? And what do you find most important for good interpersonal relations? And this is what they told me. About what did they make, were their expectations achieved? They said that at the beginning they hoped that their work would be made easier, or if it's not, that the patients would be better treated and their health would improve. And they say that luckily both of these wishes have come true, and that it has surpassed their expectations. That they can no longer imagine working in any other way than this. That they cannot imagine to go back. That the only way is straight ahead. The advantages of that kind of practice is that I work with them next door and also in the same shift. And this is very important. If she has a patient who needs, I don't know, to see me, that she can just call me, or she just bring him to me in my room so that we can talk. And she also thinks that this amount of time that I can take for, I don't know, for education, for talking, and I don't know, counseling, is very important. And this is the individual approach that we are talking all the time, and that holistic approach to the patient. And this was something very interesting for me, that because I didn't think it that way, that they think that separated prevention for treatment is very useful for them. That they can concentrate on treatment, on what they can do best. I like to say, I also told this theory of mine in the morning, that doctors and the nurses, we are not the same in no point of view. It's this, like if you would say the electrician and plumber. The plumber cannot do the electricity work, and also the electricity cannot do the plumbing work, but they both work in a house, is the truth. We are completely different, but we all have the same goal, that's patient, our patient, happy patient. They also said that the number of visits of patients per day has reduced, and that also think that it's important that routine checkups start at age 30, because we all know our young generations are have very unhealthy habits. And the problems they see that the main problem is unresponsive patients. I think it will take a while that we all will manage with this new type of work. And I also think that also this responsiveness of our patients is just a transitional phase. And this was also a funny thing, that it bothers them that I have a lot of administrative work, and I like that. I agree with them. And how do they see my work as a nurse practitioner? They see as that it complements the work of family practice, that it eases the load, and the work is running smoothly, and they're satisfied. And the good interpersonal relationship, we have, I think, the same vision about it. That it's a mutual respect and understanding are important. That it's also important that we spend a lot of time together. You know, working in a team is like a marriage. If it is good, it's good. If it's bad, no one can fix it. And that we can tell to another when we're having a hard time or the patients exhaust us, and that we can also sometimes laugh on their account. And that is always easier if everything is packed in a funny way, or that we use a lot of humor at our work. And this is where all the magic happens in our case. This is our team building. I hope that you're looking at the left side, where is the healthier side, but we prefer not anemic meat. So, and we really try to take every day at least, I don't know, 10 minutes in the morning before we start to work, to drink some coffee, to talk it through, to make some plans, and also in the middle, also if we can. Sometimes it doesn't work out, but we really try to, because this is really our team building, and this is where all the things go away, and it's just us. And I also say that room isn't always, you know. Now I would like to, for the end, just show you some examples of good practice. If you remember the case study number 2, when I was talking about a female patient. So these were at the first checkup, her weight, her blood sugar, and also her cholesterol was high. And this is after 1 year. At the beginning, when we did the checkup, she went back to the doctor, that he gave her medicine and so, and then she was coming to checkups again at my place. And she came back for the first time after 3 months, again after 3 months, and then she was, I thought that she's okay, and then she come, I don't know, 2.5 years. And these are I hope, our results. And I'm very glad. And this one is also one of the good ones. They're not all that perfect, but I like to show the perfect one. This was also a male patient. He loses weight, but it's not only about the weight. This is, I don't know if you know this scale, this is our famous Tanita. She tells you everything. And he has lost fat mass and gained muscles. It doesn't help us much if the patient needs 10, I don't know, kilograms, but all the muscles ran away, but the fat stays on. So this is a good case. These patients shocked me quite a bit, because nobody with COPD or asthma is not checking his lung function. And he came also in a regular checkup, and he was a smoker, and we find him COPD with spirometry. And I told him, we were talking about that, why it's good if he does those measurements, and he takes it very seriously. And he does this every day, in the morning and in the evening. And this is also some spirometry tests that we do, and this is why it's so important that we start preventions and the 30 years of age, just 33 of age, COPD, diagnosed and treated. Also this one, 73 of age. We all know if you are 30 years old, you start smoking somewhere around 15. So you are smoking 15 years, maybe a pack a day, I don't know. But this is why it's so important. I hope that it wasn't too bad, that if my grammar wasn't the perfect. I enjoyed it very much, so thank you, Mr. Kerstin, for this opportunity you gave me. And I must say that now I must agree with this guy. So thank you.